Welcome to our video about histoplasmosis. Symptoms of histoplasmosis. If you're interested in learning more about the symptoms of histoplasmosis, keep reading. This article explains what the disease is, what symptoms to look out for, and how the infection spreads. It's important to know that you're not contagious. Symptoms of histoplasmosis typically occur 10 days after exposure to the disease. Fortunately, short-term and acute cases of histoplasmosis rarely lead to any complications. What is histoplasmosis? People can get infected with histoplasmosis by breathing spores that are airborne. People who are exposed to spores may develop mild or severe illnesses. People who are immunocompromised are at an increased risk. Acute and short-term infections are both rare and usually mild. In severe cases, antibiotics may be required. This condition rarely spreads from person to person. Treatment for histoplasmosis depends on the severity of the infection. Mild cases can go away on their own. Patients with severe infections may need to take antifungal medications for life. In children, treatment may involve a course of antibiotics. However, in adults, the condition can be treated with over-the-counter medications that are available at the pharmacy. Patients with severe infections are advised to contact their doctor immediately for a proper diagnosis. If you have been exposed to high levels of histoplasma spores, you may experience respiratory infections, ranging from pneumonia to severe meningitis. The symptoms typically manifest 3 to 17 days after exposure to the organism. The symptoms of pulmonary histoplasmosis are similar to those of pneumonia and may include fever, chills, and a dry cough. Other symptoms may include weight loss, vision loss, and respiratory dysfunction. Histoplasmosis symptoms. Although most people infected with histoplasmosis have no symptoms, those with the disease will experience respiratory infections and general malaise. The most severe form is disseminated histoplasmosis, which can lead to fatalities without treatment. Histoplasmosis symptoms vary greatly between different forms of the disease, and they can appear weeks, months, or even years after exposure. Although histoplasmosis symptoms are nonspecific, some common signs include mild fever, loss of appetite, and depression. You may also experience enlarged lymph nodes or small lung masses on X-ray. A doctor can confirm your diagnosis by ordering blood tests and urine tests, as well as ordering an X-ray of your abdomen and lungs. Antifungal medication is the standard treatment for histoplasmosis. People who are exposed to contaminated soil can contract histoplasmosis. Bats and birds are known to carry fungus. If you work in an area where bats and birds live, you are at risk. Taking a shower or bath in contaminated water or soil can introduce the fungus into your body. The symptoms may also be similar to those of the common cold. If you're experiencing them for the second time, it's important to contact your doctor to find out how serious they are. About histoplasmosis. A fungus known as histoplasmosis causes an infection in humans. Histoplasma spores are present in the soil, bird droppings, and decaying materials. The disease is widespread throughout North America, with high rates among people living in the Ohio and Mississippi River Valley. The disease is caused when a person inhales the spores of this fungus. The fungus lives in the lungs, where it reproduces, causing an infection in the respiratory tract and the liver. If left untreated, disseminated histoplasmosis can cause kidney disease, liver failure, and central nervous system involvement. Infected people may develop mild symptoms or even pneumonia, depending on the severity of their infection. In rare cases, patients can develop more serious diseases, involving multiple organs, which can require long-term treatment. The severity of infection depends on the patient's underlying immune system and the amount of fungal exposure. People with weakened immune systems and immunocompromised individuals are more likely to develop severe diseases. Children are particularly at risk of contracting histoplasmosis. The infection is usually acquired through inhalation of the microconidia found in the environment. If the person has a weakened immune system, histoplasmosis can also spread to other parts of the body, including the eyes. If this infection is untreated, it can lead to a serious illness, called progressive disseminated histoplasmosis. In this case, the symptoms of the disease are fever, weight loss, hepatosplenomegaly, and hematologic disturbances. A skin test may be positive in 3% to 55% of cases. A urine antigen or a pulmonary culture may be positive in up to 70% of cases. How histoplasmosis spread. Acute respiratory illness caused by the fungus histoplasmosis can vary from mild respiratory infection to feeling generally unwell. The symptoms include high fever, chills, headache, muscle aches, weakness, and chest pain. The fungus can also damage adrenal glands, which produce hormones. Acute disseminated disease may spread to organs outside the lungs, such as the liver and brain. The fungus responsible for histoplasmosis thrives in moist soil and organic matter. It is most prevalent among infants, young children, and those with weakened immune systems. Exposure to bird and bat droppings, or infected soil, is another possible route of exposure. It can also spread in the bloodstream. This disease is more common in immunocompromised people, such as those who work in construction sites, agriculture, and parks. Although histoplasmosis is widespread throughout the world, it is endemic in parts of the U.S., especially the Ohio and Mississippi River Valley. In endemic areas, 50 to 80% of the population shows a positive skin test. There are a few ways to avoid contracting the disease. First, you should avoid areas where it is common. Infected areas should be inspected for signs of histoplasma. Histoplasmosis diagnosis. A clinical microbiology laboratory serves as an invaluable resource in the diagnosis of histoplasmosis. These laboratories can also guide healthcare providers in selecting diagnostic tests for histoplasmosis. Below is a brief overview of histoplasmosis diagnosis. Listed below are the tests available for the diagnosis of histoplasmosis. In some cases, conventional assays are the only option. Traditional laboratory tests for histoplasmosis diagnosis usually rely on the isolation of H. capsulatum from blood cultures or tissue samples. However, these tests are limited in sensitivity and time, which can be problematic for patients with disseminated histoplasmosis. In addition, they are not always reliable, especially in the acute and disseminated form of the disease, which requires rapid diagnosis. Depending on the part of the body infected, histoplasmosis diagnosis may be complex. Although a mild infection may clear up on its own, severe cases may require antifungal treatment to prevent further complications. In addition, it may be necessary to treat the underlying conditions in individuals with weakened immune systems. Several recent studies have suggested that the antifungal drug ketoconazole is important in localizing histoplasmosis infection. Histoplasmosis treatments. Histoplasmosis treatments may vary depending on the stage of the disease. Acute and subacute disseminated forms can affect the central nervous system and intestinal systems. Acute cases can also cause meningitis and encephalopathy. In rare cases, the disease can even lead to death. The symptoms of the disease are usually mild, but they may require a longer course of treatment. Patients suffering from immunosuppression may also require additional medication. The most common symptoms include fever, headache, and gastrointestinal bleeding. Patients with the gastrointestinal disease usually experience diarrhea, abdominal pain, weight loss, and fever. Those in areas where the fungus is common may also develop a second infection. In such cases, long-term antifungal medications may be required. While most cases are mild, they can last for several weeks or even a lifetime. If you suspect that you have histoplasmosis, consult your doctor immediately. As with any bacterial infection, the most effective histoplasmosis treatments are individualized to the individual. Patients with risk factors should seek medical care if they have respiratory symptoms or are experiencing any of the other symptoms. In rare cases, an infection may occur after several days or even years of exposure. Nevertheless, the best way to diagnose histoplasmosis is to undergo a biopsy. A biopsy may also help to identify the organism. Risk and prevention for histoplasmosis. People with compromised immune systems or those exposed to high-risk occupations are at higher risk for histoplasmosis. People with pre-existing lung diseases are also at increased risk. There are several symptoms of histoplasmosis, including pulmonary infection and disseminated disease. People with HIV/AIDS, organ transplants, or those taking immunosuppressive drugs are also at a higher risk for developing the disease. Histoplasmosis is a fungus that lives in soil throughout the world. In the United States, the fungus is primarily found in areas of central and eastern states, including the Mississippi River Valley. Other areas may be endemic to histoplasmosis. The infection can be acquired in both endemic and non-endemic regions. Risk factors include exposure to wildlife, contaminated soil, and bat droppings. 1/3 of histoplasmosis outbreaks occur in places where soil and plant material are disturbed. This could be through demolition, excavation, or gardening. People who work with soil and plant materials should wear protective equipment to reduce the risk of infection. Exposure to bat droppings is also possible in a number of occupations. In addition to bats, the risk of contracting histoplasmosis is very high in some places. Thank you for watching. Please like, comment, and subscribe if this was helpful.